Hello everyone, so we are going to do chapter 30, adolescent medicine, features of adolescent medicine, the adolescent. Um, Consultation differs in pediatric consultation, the head's acronym, system taking on psychosocial history, chronic illness may impact on adolescent development, which in turn may impact on the chronic illness, adherence, prominent mental health problems like eating disorders and self-harm. Adolescence is a transition for childhood, from childhood to adulthood. There is no clearly defined age range, but is usually considered to be from puberty to 19 is a phase of the development to adulthood continues into the third decade. There are 7.4 million adolescents in the UK, 10% of the population, with increased proportions observed in ethnic minority groups. Transition from being a child to an adult involves many biological, psychological, and social changes. With adolescent brain development continuing into the third decade, pubertal development is considered. Difficulties may arise if the pubertal changes are early or delayed. While senior practitioners will see all adolescent medical problems, difficulties may arise when obtaining such as medical care. Those less than 16 years old are generally looked after by a pediatrician or 16 years old by either pediatrician or more often by adult physician and surgeons. However, pediatric facilities children are often geared to the needs of young children rather than adolescents, but other older resources may be overwhelmed by the medical conditions encountered at the walls and independence expected of them. Adolescent females with gynecological trauma are often cared by a gynecologist, usually in adult facilities. Some pediatricians will care and now specializing in adolescent medicine in similar way to North America and Australia, and the number of facilities focused on special needs adolescents increasing. Communicating with adolescents, the adolescent consultation differs from pediatric consultation for young children that the adolescents potentially play a active role in the consultation, although the health professional may need to advocate for the young person and their evolving autonomy. As well as seeing adolescents with their parents and intelligent competent adolescent healthcare is offering to young people the opportunity to be seen independently of their parents for at least part of the visit. They, however, still have the right to chaperone, but it should not be assumed the latter should be a parent. Another principle is that the parent should ideally not be seen alone after the adolescent has spent time with the doctor so that the adolescent can trust that whatever confidences have been disclosed to the doctor have been kept. Some practical points of communicating and working with adolescents are make the adolescent to set the person the consultation. Be yourself when establishing rapport. It may be appropriate to engage adolescent by talking about his or her interests, football, films, or music, but do not try to be cool or also patronizing. Relationship should be as his or her doctor, not as a friend. Consider the family dynamics and mother or father understand for the person. Does the person simply want this or resent being interrupted? Developmental changes of adolescence interference. Avoid being judgmental, lecturing, avoid you statements and use I statements in presence. I'm concerned that you're frank and direct approach your best. Your role should be that knowledgeable, trusted by the parent from whom they can get advice with the truth. An authoritarian approach is likely to result in a rebellious stance. Working things out together in practice, it has the best chance of success. Frame difficult questions so they are less threatening and judgmental. Some teenagers drink alcohol. Do any of your friends drink? How much do they drink in a week? Do you drink alcohol? How much do you drink and play with them? Likewise, when asking sensitive questions like the sexual health, always give young people warning and explain the rationale of why, especially need to be asked. Do not perpetuate myths in your questions to the young person. Lots of young people smoke. Do you? Only 3% of 11 to 15-year-old people take up smoke regularly, although this increases to 1 in 5 in 16 to 12, 24-year-old age group. Confidentiality is particularly important to this age group and must be respected. Explain that you will keep everything you are told confidential unless they are or somebody else is at risk of serious harm. Always assess the adolescent's understanding of confidentiality and correct any misunderstanding. HEADS acronym for psychosocial history taking home life education activities, home life relationships, social support, household chores, school exams, work experience, career, university, financial issues, activity, exercise, sport, other leisure activities, social relationships, friends, peers, who can they rely on bullying, drug use, cigarettes, alcohol, how much, how often, weight, caffeine, diet drinks, binges, and vomits, etc. Health concerns, periods, conception, and in relation to medication, sleep is how much hard to get to sleep, weight, often suicide effects, early waking depression, self-harm, body image, safety issues around substance use, sexual activity, internet use, which platform, social media, which platforms, duration of reason can be impactful, self-confidence, self-bullying, and sexting. Bear in mind a proxy presentation of abdominal pain when the real reason anxiety about the possibility of pregnancy or STIs or the result of recreational drug use. A full dose of psychosocial history useful to engage the young person to assess the level of risk as well as identify protective or resilient factors and provide information that will aid the formulation of effective interventions. The heads acronym may be helpful in this regard, although question must always be tailored to a stage of development. The right of the young person to not answer should be respected. Communicate and explain concepts appropriate to their cognitive development for young adolescent use. Concrete examples here and now rather than abstract concepts is then history taking should avoid making the assumption of heterosexuality with questions about romantic sexual partners asked in a gender neutral way. They need to have a physical examination that protect their privacy and personal integrity. Who do they want present? Also find out if they would prefer doctor of the same sex if this is an option. Talking, listening with young people. Always give them the opportunity to see what their parents, explain and show confidentiality, psychosocial support useful to engage on people assess risk, identify protective resilient factors, they assist combination of the intervention. Always give time for the young person to answer. Was the development changes, early doses, early stage of the weight between breast parts, puberty development start at adulthood, basically realized when the male start at adulthood, conflict thinking, but begin to develop moral concepts and awareness of their sexual identity. Social is the early emotional separation of parents start at strong peer identification, early exploration behaviors may start smoking, later adolescence, females end up growth spurt, menarche, change in body shape, males, sperm production, voice breaks, and then start with growth spurt, acne and blushing, need for no sleep. Abstract thinking, but still sleep as bulletproof, seen as benefit. Increased verbal dexterity may develop a fervent, like religious and political continuing, emotional separation from parents, strong periods, peer group identification, developmental or sexual identity orientation, early vocational. Late adolescence, males identify puberty, continuing growth of height, and to growth weight fusion, usually 15 or 18 in females, and 18 to 22 years in males, and then strength and body hair, complex exact thinking, and identification of difference between law and morality, increase impulse control, further development of personal identity, further development of rejection ideology, social autonomy, may develop intimate relationships, further educational and employment, where they develop financial independence. Between the difference between concrete. You said I'll get ill if I miss my inhalers, but I forgot them twice and stayed fines. I don't need them anymore. This is part next. Start thinking, I miss my inhalers a couple of times. I think I got the day with it because I was doing myself. I think I still need them in the future if I'm doing this is abstract thinking and management of as young the child and the adolescent. And consent and confidentiality. In the consent in the UK, young people can give consent if they are sufficiently informed and um, either below 16 years old or under 16 years of age and competent to make decisions for themselves. This is called getting confident. Conflict really arises while treatment is usually person having a brains and opportunity that it is necessary. Handling of disagreement over consent is considered